My name is Elston Johnson, and my specialty is in general cardiology. So, when I initially started, my education out of high school, I thought I wanted to go into chemical engineer. Um, when I, completed my first year of education at college, I, had the opportunity to talk to some friends, and they kind of talked me into going into nursing. I did my two-year degree, and then I did my bachelor's degree in nursing, all while working as a nurse in the ICU. And I absolutely loved my patient interactions, getting to get to know my patients on the floor, giving them that educational opportunity before the discharge. But one thing that I felt like I was missing was, you know, the question of why am I doing what I'm doing in regards to the patient's treatment. And so that why question is what kind of drove me into medical school. And so it kind of continued my education and went to medical school and, absolutely just, love what I do now. Being able to incorporate all that, being able to talk to patients about preventative medicine, preventative health, to try to get them from having those disease processes that can really affect them for the long term. Absolutely just love that. When I went into internal medicine, I absolutely love that aspect of things, love the outpatient world, getting, like I said, once again, to know my patients really well. And I actually thought I wanted to go into pulmonary and critical care because that's what I did as a nurse. But once I had the opportunity to kind of be on the floor and experience and had really good mentors in cardiology, it kind of pulled me into that interest. And one thing I love about cardiology is that a lot of cardiology is preventative medicine. A lot of times when people develop heart attacks or they develop strokes or they develop issues with, what we call perfusion or ischemia in certain areas of their body, a lot of that is preventable. And I love being able to talk to my patients and trying to prevent those disease processes from deteriorating and causing them issues in the future. And that really drove me into cardiology. That's one of the things I try to incorporate, certainly in some of these outreach things I do for, the church that I go to. Definitely trying to talk to the youth and the younger population to try to get them to understand, the things that you do now will affect you for your lifetime, and making the right choices now in regards to not only in regards to your education, but in regards to your health. Making the right choice and not to smoke, making the right choice in the foods that you eat, avoiding those fast foods. Those are the core things you really want to do, along with telling them that, education is a core component, and trying to make sure you have a good lifestyle.